When you are not feeling well in Japan, how do you choose the right medicine? How far can you go with OTC medicine? And when do you need to see a doctor? If you know this before you get sick, it can really help you stay calm and get the right help quickly. In this video, let's learn how to choose medicine wisely in Japan. Hi everyone, welcome back to my channel. I'm Jun, a licensed pharmacist from Japan. On this channel, I share basic information and introduce healthcare products you can find in Japan. And just a quick reminder, please make sure to check the disclaimer before we start. Here's our today's topics. We look deeper at how to choose the right medicine in Japan. From this point, which symptoms you can treat with OTC medicines, the best way for foreigners to buy medicine safely, and simple guide to Japanese medicine manufacturers. In Japan, the government officially defined OTC medicines as drugs that have only mild impact on the human body. They are meant to be used safely by consumers themselves, based on information provided by pharmacists or other healthcare professionals. So in short, these are medicines you can buy without a doctor's prescription, but still with some professional guidance. That's what the Japanese government means when they talk about OTC medicines. This is the definition of the OTC medicines in Japan. Based on this definition, OTC medicines are expected to play several important roles in society. First, they help relieve minor illnesses, things like colds, headaches, and stomach aches. And second, they help prevent symptoms that comes from daily habits, for example, fatigue, poor diet, or lack of sleep. And third, they help improve quality of life, or QOL in other words. They help you feel better and live more comfortably. They also allow people to check and manage their own health before small issues become serious. Next, they support the maintenance of overall health through regular self-care. And finally, they contribute to public health by reducing the burden on doctors and hospitals. So overall, OTC medicines in Japan are seen as an important way for people to take care of themselves and support the country's healthcare system as a whole. Sometimes it's better to see a doctor instead of using OTC medicine. Even though OTC medicines are convenient, they are not always the right choice for every situation. First, if you are already taking prescription medicines, or if you have a chronic disease, you should talk to a doctor because some OTC medicines can interact with your prescriptions or worsen your condition. Second, if you have pregnant, breastfeeding, or giving medicine to a young child, you should also check with a healthcare professional. Some ingredients can affect babies or children or pass into breast milk. Third, if your symptoms are severe or don't go away, that's another reason to see a doctor. OTC medicines are meant for mild problems, not for high fever, strong pain, or serious illnesses. Fourth, if you have history of allergies or bad reaction to medicines, be very careful. Avoid using similar products if you have had a rash or side effects before. And finally, if your symptoms don't get better, or if they get worse after using OTC medicines, that's a clear sign you should stop using them and see a doctor. So overall, please remember, OTC medicines are useful for small health issues, but when something feels off or doesn't improve, always ask a professional.
To master Japanese drugstores, grab our full guide. It covers everything you need to know.
Okay, next page. In Japan, some medicines are too strong or too risky to be sold over the counter. These are called prescription-only medicine. They can't be bought without doctor's approval. Let's take a look at some examples. First, anti-cancer medicine. Next, antiviral medicines. They also need prescription, except for mild cold sore cream. Those are available OTC for things like herpes labialis. Third, anti-diabetic medicine. Then psychotropic medicines. These are strictly controlled because they can cause dependence or mental side effects. Also, strong sleeping pills also require prescription. However, mild ones containing diphenhydramine can be sold OTC. Next, antibiotics, but topical antifungals like creams for athlete's foot are available OTC. And finally, antihypertensive medicine, drugs for high blood pressure. All of these require medical supervision to make sure they're safe and effective. So remember, these medicines are not available OTC in Japan because they need careful control and professional monitoring. Alright, now that we have covered the basics, how should you actually choose a medicine in Japan? I'd like to share 3 tips that I personally recommend. First, decide on the medicine you want to buy before you go to the store. The smoothest way is to save the product name and picture of the package on your smartphone or simply show it to the staff. It's much easier to visit the drugstore when you already have some information rather than going in completely blind. Did you think? Next, check the information written on the package. In Japan, OTC medicines are required by law to show the ingredients, effects, and warnings on the outer box. Using a translation app like Google Translate to read Japanese on the box can be very helpful. Finally, tell the staff about your symptoms and any ingredients you prefer or want to avoid. Since many staff members are not very confident in English, it can be a good idea to use translation app while you talk with them. These are the 3 methods I recommend. Let's go through the first one in more detail. First, internet search. You can check the Self-Medication Database Center website, or JSMDBC for short. It lets you search by active ingredient name, like acetaminophen, by product name, like Pavron, or by effect category, such as cold remedy. Here is a link. You can switch languages here by clicking English. Here you can search by body parts or search by indication. If you want to know cold remedy, check here and search. You can see information like this. Click on each product to see more details. You can see the information like this. This product is available in languages other than English. Next, you can look at the online stores such as Amazon, Rakuten, or Sandrak online store. Online information can be helpful, especially to compare products or prices. Here we are looking at the online shopping page for Sandrak. So search Sandrak and this one. You can select language here, and pharmaceuticals and quasi-drugs is here. You can check the information like this. You can use this site in multiple languages, and you can use it just to get information about the products, and it also seems to support international shipping. Second, books. Use books written by professionals, pharmacists or doctors. Our own book is written by 2 pharmacists and available on Amazon and other platforms. For more details, check the description box. And third, ask AI. You can also use AI tools like ChatGPT to find medicine information, but remember, AI might not always provide the most accurate or up-to-date data, so always double-check with a pharmacist or reliable source. So in short, before visiting a Japanese drugstore, check online, read book, or ask AI, and you'll save a lot of time. Also, you can view all official manufacturer package inserts from this website. Most are in Japanese, but feel free to pause the video and take a look if you are interested. This is an introduction to translation apps. You can translate in real time just by pointing your camera at the product. My recommendations are Google Translate and DeepL. These are very useful. Please give it a try. Okay, next page. When buying medicines in Japan, you can always find qualified staff who can help you choose the right product. There are 2 main types of licensed professionals you may meet in a drugstore. First, the pharmacists. They are nationally licensed professionals who can handle both prescription medicine and OTC medicine. Pharmacists have high expertise. They can even give medical advice. They wear a name tag that says Yakuzaishi or pharmacist. But keep in mind, pharmacists are not always available during all store hours. Second, the registered sales clerk. They have a license for selling OTC medicines only. Most drugstores have at least 1 registered sales clerk on duty. They can sell Class 2 and Class 3 medicines and provide basic OTC knowledge. Their name tag says Toro Kanbaisha, and they are usually available throughout store opening hours. So in short, both pharmacists and registered sales clerks can help you choose medicine safely. Just tell them your symptoms or what ingredients you are looking for. Okay, next topic. Here is the typical medicine shelf. In Japan, you can see so many products lined up neatly. Actually, there's a specific rule for how they are displayed, and stores follow that rule. In Japan, medicines must be displayed by their category of effect. That means by what kind of symptoms they treat. They also have to be separated by risk class, just like we talked about earlier. Mixing medicines with other products on the same shelf would actually violate the regulations. So if we are looking for supplements or health foods, you'll usually find them on a different shelf. Okay, our last topic is manufacturer. So, which company's products should you choose? Here are some of Japan's major and well-known pharmaceutical companies. In Japan, medicines are manufactured under a strict production standard called GMP, Good Manufacturing Practice. And Japan's GMP is considered to be on the same level as those in US and Europe. However, in recent years, some pharmaceutical scandals have been reported in Japan as well. Because of that, the authorities are now tightening regulation to ensure product safety. Even so, overall the quality of Japanese medicines remains very high. Large pharmaceutical companies tend to be more transparent and publish detailed product information. Here are some other pharmaceutical companies for your reference. Of course, there are many more pharmaceutical companies operating in Japan. Alright, thank you so much for watching until the end. Here's a quick summary of today's lesson. Japanese OTC medicines are designed for mild conditions, not for serious or severe symptoms. To choose the best medicine, it's a good idea to do a bit of research before visiting a drugstore. And remember, you can always ask a pharmacist or registered sales clerk if you need help. Most products in Japan are high quality and safe. But if you are not sure which one to pick, it's safest to go with a major brand. So don't worry, with a little preparation and the right advice, you can find the perfect medicine for you in Japan. Alright, in the next video, we will take a closer look at each category. For now, thank you and goodbye. お疲れ様でした。